Hi, my name is Dr. Ayesha Zia, and I am an emergency physician at the Ottawa Hospital. When you come across a person who is bleeding, it is extremely important to intervene very quickly, as your intervention as a bystander can truly save someone's life. When a victim is inflicted with a stab wound of some sort, they can bleed out within minutes, and therefore it is really important to control that bleeding and to get this patient to the hospital as soon as possible, as this could be the matter between life and death. If you see someone bleeding, the first thing you should do is call for help and call 911 so the paramedics can get there as soon as possible. Please tell the 911 operator what has happened, as they may also be able to guide you through the next steps. If the patient is actively bleeding, you can grab either gauze or just a clean cloth and try to put pressure on the site of the wound. I want to remind everybody that if you are applying gentle, firm pressure to a stab wound, then don't peek and look to see if the bleeding has stopped. Don't move your hand from where it is, and just hold steady, firm pressure at that site. If you see that they have been stabbed by a knife or a sharp object, do not try to remove that object, and just apply firm pressure around the wound site while keeping yourself safe. Look for signs of severe bleeding, such as blood that is spurting out, or blood that is pooling, or blood that is underneath the patient, as those can be easy areas that can get missed, especially in a state of panic. What you do in these few minutes could truly save somebody's life and prevent them from dying. When you see a patient bleeding from their arms or legs, the first step to do is to apply gentle and firm pressure with the gauze or a clean cloth. If despite the application of firm pressure, there is excessive bleeding, then the application of a tourniquet can be helpful in this scenario. A tourniquet must be applied above the wound site and can be tightened to control the bleeding at that site. And that can be left on until help arrives and until the patient is taken to the hospital. A tourniquet cannot be left on for a really long time, and this patient needs to be taken to the emergency department as soon as possible so we can remove the tourniquet and do a better assessment of the patient's bleeding and wound. If you don't have access to a tourniquet, you can make a tourniquet using a piece of cloth that may be available to you on scene. Try to use a clean cloth, and you can even use something like a t-shirt to make a tourniquet.